This is an organization based in Pakistan, for the time being working in Pakistan, for the promotion of One Health for emerging infectious diseases, you see. And we have been doing a lot of work. We established in 2014, and a number of projects and programs we have already implemented in the country, which included vector-borne diseases, which included biosafety and biorisk management, which included recently we did a project on antimicrobial resistance, you see, because all these areas are One Health related areas, and we have the privilege of promoting One Health in Pakistan and making people realize the significance of One Health. So in the ongoing project, we would be developing in One Health disease surveillance dashboard, which we have already done in consultation with our partners, and also some event-based surveillance. Event-based surveillance is also a new activity, because there are indicator-based surveillance systems already going, good or bad. Because the One Health is not only health department, it is animal health, public health, environment, food. In livestock department, animal health department, they are still struggling to establish a surveillance system. So we are trying that under this project, that these systems speak to each other, and there is some cohesion and there is some commonalities are developed, because there are a group of diseases which have similarity in the public health and in the animal health, and they are of significance to human beings, the environment issues, the food issues, and in this world where there is a lot of interaction with the public and lot of the globalization kind of environment. One Health is of great importance, and I think we are lucky that our departments are now started realizing that, you see, and they come to our workshops, meetings with great enthusiasm and talk about planning and expansion of these programs, you see, while keeping us as like the focal point or like a facilitator of this important task. They come to our meetings, and we are now developing capacity building programs. We have already developed a curricula on One Health and curricula on event-based surveillance, and we have engaged institutes, training institutes of public health, training institutes of veterinary sciences, training institutes of environment, where these programs, we have already organized training of trainers workshops, but now these training centers would be organizing regular workshops on One Health, on event-based surveillance, on One Health disease surveillance dashboard, and like that. So all that essential components of One Health, essential components of event-based surveillance are part of our curricula, which has been developed in consultation with the multiple stakeholders. Once you are talking about the vision, it means you need to standardize things. You need to standardize definitions. You need to standardize indicators. You need to standardize software so that they are compatible with each other. So such kind of things. But yes, there is a good thing is that we have sport, we have political ownership, and I think with the passage of time there would be a lot of improvement. And this our project has been being appreciated by all levels. To me, it is intersectoral coordination. So that is One Health. For example, aside from people all the time talk about zoonotic diseases and vector-borne diseases are the best example of One Health, and some other diseases. But I say like roadside accidents, you see. Roadside accidents are very rampant in the country, and there are multiple departments which are involved in doing it. So this sense that it's not only any accident, any emergency, health emergency, It's not the role of one department, which has already thought is public health, it's a health emergency. It is several departments, and there has to be culture. There has to be way. For example, the COVID came, and it was badly realized that there has to be a national, provincial, district level committees, intersectoral committees, which should take care of it. Livestock department, they have done in one province, Punjab, they have established an application which has three components. One is the surveillance information from veterinarians, you see the senior people, in the district level the qualified people. Other is by the paramedics who are not that qualified, but they work in the community on behalf of the department. And third is for the community itself, the three parts of the application. So these application, the community is being oriented that if they see this and this problem, very simple information, they can think about it could be this, and they need to report to the paramedic will go and certify, it will go to the veterinary officer in the district level, he will then certify it and then send it to. So there is a mechanism being applied, the application has been developed. The dashboard is, we are trying to create linkages between the various multiple MISs of the departments, so that some common information emerge on certain diseases, and there could be common analysis, common decision making, common planning. A culture of common planning need to prevail at the multiple level. And there has been the case for dengue, for COVID, for isolated examples. Population is, you see, increasing in our country and also in several other countries. You see globalization, urbanization, you see the interaction between communities on rise. There is a travel, you see, taking place, air, road, train, you see, and lot of use of poultry, lot of, you see, everybody's house need, and so a lot of use of other animal. So as the population increases, we need to increase the food production, and you see the animal production. There is always a risk that you see such kind of epidemics can originate and spread fast, because in the good old days there was no much urbanization, and people were living apart, and there was no such kind of interaction. We have been blessed with having a network in Southeast Asia, and initially it is called OHASA, One Health Surveillance Network, and then it was a regional benefit that we could get out of this is interaction with the like-minded people you see in the region, and then this gives us a great opportunity to interact with the colleagues in the region, because regions have almost similar issues, problems, and types of diseases, you see, especially in our, and every region has its own peculiar, because our circumstances are similar to, say, India, say Bangladesh. In the recent past, we have been not only organizing meetings, but we did a study on antimicrobial resistance, which was supported by Fleming Fund, and you see, Pakistan, Bhutan, Nepal, Afghanistan, Sri Lanka were part of that exercise, and to some extent India was also there, and that was a wonderful you see activity. We had repeated interaction virtually and physically also once, so we have good connections and links with that country organization, and they have too. And we take really pride of having these relations. A number of diseases are similar. Like if you talk about dengue, dengue is everywhere. So we need to learn how the others are doing, and they need to learn from us. Because we have similar socio-economic structure, similar environment, similar weather. So there are a number of commonalities which make us learn from each other.